How do you go about applying a human rights-based approach to programming? Karen Greiner, a C4D Specialist working on polio communication in UNICEF Chad, shares some thoughts and experiences.
When I think of human rights-based approach, one word that comes to mind is inclusion. And I remember sharing the other day with a colleague one of the quotes that I really like from the disability movement, which is "Nothing about us without us." And in UNICEF Chad, I'm working in the polio unit, and we do a lot of large-scale polio vaccination campaigns. And we had the opportunity to partner with an association of people living with handicaps in the capital city. And I recall that they did early support for us in these campaigns without any kind of not needing any financial support. They just wanted to contribute. And what they were mostly proposing was testimonials during campaigns. I'm living with polio. I'm in a wheelchair, and it was, in my mind, it was not ideal, because part of it was kind of like, look at me, don't let your kids become like me. But in discussions with them, and later through a small scale agreement partnership, we were able to kind of expand their contribution. And so during campaigns, they'll do sessions for vaccinators, or they'll go out and do supervision of community mobilizers or vaccinators, and they'll go to home visits, or they'll help with cases where parents are refusing to accept polio drops. So their participation has expanded quite a bit. And for me, it exemplifies kind of this human rights-based approach where you're trying to seek people to help them contribute, people who are affected, in this instance, by polio, and have them go beyond being just, kind of like poster featured, fear appeals, don't become like me. So I'm pretty proud of that collaboration. I'm convinced that there are groups of people ready and willing to collaborate, and on a range of issues, if we can just, sometimes stop what we're doing and take the time to think about, who should be with us. This idea of nothing about us without us. It's like, if we're sitting in a room and we're designing something where we're trying to, increase something like birth registration, like, are we including parents in our discussions? So it's not just about human rights, but it's also about good design, about getting the people that you're ultimately trying to serve as stakeholders and sitting at the table. So I think that in every country, there are going to be people who could be contributing. And I just ask whether we are taking the time to sometimes slow down, or take the necessary measures to invite them.
For Hedy Ip, a nutrition specialist with UNICEF Myanmar, the main challenge is not so much about setting the broad development agenda. Hedy, who has worked in Burundi and Bangladesh, says it's more about how to engage communities in discussions about how to best communicate behavior change.
Yeah, I think what tends to happen is that, technical experts and government decision makers, they sort of determine already sort of the what, in terms of what should be done, or what key behaviors or attitudes should be promoted in C4D. But then the how, how do we actually get these behaviors to be influenced? I think that involves, in my experience, that's where a lot of community consultation and engagement happens, in terms of what people feel are the most effective ways to communicate and these messages. So I think that's a challenge, is that how can we get that right? How can we get that community participatory discussion right from the beginning, instead of kind of making it sort of a quick assessment? Okay, we've done that in one area, and let's just kind of go to scale with the intervention. Another challenge also is that different communities coexist, and they have different attitudes, and they have different beliefs. Like, for example, in Myanmar, in the south West areas, you know, you have very, very different religious and ethnic communities living side by side. So another challenge is, you know, how do you consult them in a way that is also reflecting and capturing all the different beliefs and attitudes, which sometimes can look or perceived as being very different or even conflicting with each other. One example that we're currently experiencing now is that we know that in Myanmar, the exclusive breastfeeding rates are very low. Okay, so one of our objectives is that we would like those exclusive breastfeeding rates to be high. But there are many reasons why are they low in the first place. And a lot of it has to do with perceptions and taboos about what children should be fed during the first 6 months of life. So I think that already there at that point, we then go into communities and we say that, okay, we've done, you know, CAP surveys, and it's shown that a lot of parents feel that, you know, the milk is not enough, and that in the hot season they're thirsty and that we need to give water. And then from that say that, okay, based on this, what, and then carry them through that, sort of define with them what should be the specific tailored message, because I don't think that C4D will be effective if we just promote the what, which is breastfeed your child for 6 months exclusively, right? Without tackling specifically the perceptions. I think that the message should be that, yes, we should exclusively breastfeed our children, but, and then that message should then tailor into what the perception is that maybe milk is suffice for your child, or it quenches the thirst for your kid, you know, so it targets that specific perception. So I think that type of nuanced message needs to come from community understanding and participation that you can't just get from statistics in the DHS, for example.